It's Lisa DeBoer. My husband Scott DeBoer and I started Pedi-Ed-Trics over 20 years ago, and we've been doing training classes all over the world. But in the recent years, we've created this new pediatric training system that ultimately reaches more EMS and ER professionals than we ever had imagined. And we keep getting questions like, so how did you come up with the idea, or why is this such a big deal to you? And I guess when I think back to when I first started as a brand new EMT, and I didn't even completely understand what was happening because I was so new, this new paramedic, actually he had not been working for very long, a few months, got a call for a child on the bottom of the pool. And he ran the call and freaked out at the call, and grabbed the kid and threw him in the ambulance, and they drove like, you know, a bat out of hell basically to get to the hospital. Unfortunately, you probably know how this scenario ends. The child died. That medic ended up having PTSD, and he left EMS eventually. And I mean, it's a horrible, horrible thing, because this story is not uncommon. And you know, fast forward to, you know, a couple of years ago, we were at a pool party, and my niece, who at the time was 2 years old. And what happened, Harper? Can you tell them what happened? You had a floaty on and someone took off your floaty, right? And then what happened?
I went to the bottom.
She went down to the bottom of the swimming pool. And thanks be to God, her Uncle Scott saw a shadow on the bottom of the pool and got her out in time. But it was terrifying, and I couldn't believe how it affected me so deeply that after all of these years, I started to wonder, is somebody gonna grab her and just run because they're not used to running a 2-year-old full arrest? And it's a horrible thing to feel, but it kept making me wonder, am I doing enough? Are we doing enough as a company to help continue training and improving the skills when it comes to pediatrics? So we created this entire system to help, you know, EMS professionals, emergency professionals practice their pediatric skills. And one of the Manny kids that we call them in this case, because there's 9 of them, all 9 color zones of the Brazil tape, so we have 9 of these. One of the boards is actually, this is my niece. This is Harper. And she is my inspiration and my reason why. Because if I didn't care enough before, yeah, this little one, she is my heart. And I want to make sure that everybody has as much training as they possibly can, because God forbid, every one of us has a Harper in their lives. Every one of us has a child that we care deeply about, that we would never want anything horrible to happen. So we created a system to just allow emergency professionals to practice their skills when it comes to peds. It's our way of leaving a legacy and hopefully helping the next generation of emergency professionals. So that's just our story of why we created Scenarios in Seconds and why it's so near and dear to our hearts. And hopefully this program will help so many more in the future. So thanks for watching, and God bless.